Hi everyone, this is going to be a very quick video on brain natriuretic peptide or B-type natriuretic peptide. Now this is a hormone that, if you watch my video on atrial natriuretic peptide, is quite similar in nature. However, it doesn't necessarily allow for a decrease in blood pressure, but it is still increased when the stress on the heart increases. So, brain natriuretic peptide, or BNP, is released from the ventricles of the heart. And it's released when the stretch of the ventricles increases. So, as you know, whenever blood pressure increases, the stress on the heart is going to increase as well. And before the heart is able to adapt by increasing its heart rate and stroke volume, and possibly even allowing for hypertrophy, ventricles stretch because there is more blood coming back to the heart. And by stretching, they allow for the release of this particular hormone. In terms of an ionic and more chemical perspective in the release of brain natriuretic peptide, it is actually calcium ions that allow for the release of this peptide. And that makes sense because in the contraction of muscle and the events that occur in muscle contraction, calcium is one of the most important ions that is used to allow for the binding of myosin heads to actin binding sites and the movement of muscle fibers to allow for the actual contraction of that particular muscle. So if there is an increased flow of calcium ions, let's say out of the sarcoplasmic reticulum to bind to the actin binding sites in cardiac muscle cells, then it is this stimulus that allows for the release of brain natriuretic peptide, because if more calcium is being released, there obviously has been an increase in blood pressure, and that signifies that there has been a stretch in the ventricles of the heart. Now, alright, so brain natriuretic peptide is released when there's an increase in blood pressure, but what does that actually show? Well, if we use brain natriuretic peptide as an assay or as a marker, it is actually quite well associated with pathological hypertrophy. So, say if we take some blood from a patient that we suspect has pathological hypertrophy of the heart, possibly because they have had an extended period of time of hypertension, we can test for this particular peptide in their body. And if it is present, doesn't have to be in a high amount, but if it is present, then we can rule in the possibility of left ventricular, or for that matter, any ventricle that's being affected, hypertrophy. On the flip side, if we are suspecting hypertrophy in a patient, but we don't see brain natriuretic peptide present, then like it being present, we can actually rule out the presence of hypertrophy. So brain natriuretic peptide is effective in both means. If it's present, it can rule in hypertrophy, and if it's not present, it can rule it out. So in review, brain natriuretic peptide is a peptide, or essentially a hormone, that is released from the ventricles of the heart when there is an increased stress on the heart, and its main stimulus for a release is an increased flood of calcium ions due to the heart having to pump harder and faster. And when it's used as a marker or in an assay, it allows for the indication of pathological hypertrophy, which is when there is extended periods of time of hypertension or cardiac failure. And if it's not present, well, then we can rule out any form of hypertrophy. So I hope that has all made sense today. Thank you very much for watching.